This is Vermont Edition. I'm Michaela Lafrac. This hour, we'll be talking about a disease that touches many families in our region quite personally, Alzheimer's. It's a progressive brain disorder that causes memory loss, confusion, and difficulty with language. Later in the show, we'll talk with two people who help connect others to Alzheimer's care and resources in this region. They'll tell us about the latest research going on, local support for caregivers, and much more. Now, if you are supporting somebody with Alzheimer's, or perhaps you are in the early stages of the disease yourself and you have questions about these issues or a personal story to share, please call in at 800-639-2211. You can also write us throughout this hour at vermontedition@vermontpublic.org. First, we are joined by a woman who knows exactly what it is like to watch Alzheimer's progress in someone you love. Heidi Levitt is an acclaimed casting director who, alongside her husband, Charlie Hess, splits her time between Stowe, Vermont, and California. She's the director of the film Walk With Me. It follows her and her husband's journey as they navigate his early onset Alzheimer's. It screened earlier this year at the Middlebury International Film Festival, and it's screening again locally this Saturday at the Vermont International Film Festival in Burlington. Heidi, welcome to Vermont Edition.
Thank you.
First, I just want to say congratulations on this film. It is so intimate and informative, and it helped me understand Alzheimer's in a way that I never did before watching you and your husband's journey.
Thank you.
The film starts with some really beautiful archival footage of you and your husband on your wedding day more than 30 years ago. And I would love to start this conversation by hearing a little bit more about your love story and how the two of you first met. You grew up in very different places, yes?
Yes. So I'm originally from Montreal, Canada, and I grew up coming to Vermont my entire life. And my parents, the house that we're in Stowe, is my parents' home. So I also grew up in the 70s, and Quebec was going through a separatist movement. And my mom was American as well. And so I had an opportunity to go to the United States for college, and I really wanted to do that partly because it seemed like there was more opportunities, and like everything in America, it was bright and shinier. And I had, like I said, I had gone to camp on Lake Dunmore. I was always infatuated with American culture, which is slightly different than Canada. Now, in retrospect, I really appreciate being from Montreal and being bilingual and the experience. I met Charlie after we graduated from the same university, although I went to Barnard College, which is part of Columbia University, and he went to Columbia. So we were in New York. We met each other. I actually was working in news after college at CBS on the election of 1984, and I was a political analyst for CBS News and the New York Times poll. So I'm very excited to be with you here, Michaela, in this news environment.
Yeah, your news background.
Yeah, because that was how I saw myself originally. Like, I thought I was going to be a journalist, and I wanted to be a producer of 60 Minutes. You know, I was in love with that. But I also was a theater kid, and I loved theater and film. And when I was in New York in the early 80s, that was the dawn of independent cinema that was breaking out again. You had Jim Jarmusch's film Stranger Than Paradise, Blood Simple by the Coen brothers, and Desperately Seeking Susan Seidelman's film. And I went on a date with Charlie to Susan Seidelman's film, and I had worked off-Broadway, and so I knew all of the supporting cast. There were great people in that movie. Besides, it was Madonna's launch of her career. And I thought, wow, this is really interesting. I knew who they all were because I used to go to all the theater. And I read an article in the New York Times about the casting directors. Mm-hmm. And I was like, oh, wow, that sounds like an interesting job. And I put together a resume and headed down to that theater where they were working. And they were like sort of the it casting directors of the moment, Risa Brayman Garcia and Billy Hopkins. And they sort of hired me as an intern, and I quickly became their assistant, and then ended up going back to graduate school at the American Film Institute because I realized I wanted to learn about filmmaking. So I segued from this political sort of interest in journalism. And Charlie, at that time, he is always known who he was. And you see this in the movie because he talks about being an art director, and he always was a designer, and he studied architecture. And yet we both went to liberal arts college, and we didn't have this skill set of either me in working in film or him in graphic design. So he goes back to LA. We go together, go to graduate school, and the rest became history.
And build a life. You have two
Yeah.
children together as well. And I'm glad you brought up Charlie's career as an art director. So we have a clip from the movie from him describing that career, which he loved. He was leading photo shoots, creating these beautiful visual spreads in magazines, and then eventually, because of the progression of his disease, was no longer able to do that work in the same way.
It was a most wonderful job until suddenly I couldn't do the basic things that I had done every single day of my career. So fonts and photo shoots and all of these things, I couldn't do them. I could look at the computer and I didn't know, oh, I know this, but I don't know what comes next. It was the scariest time I've ever been in my life. I knew something was really wrong.
Oh, Heidi, you say in the film that looking back, you could see evidence kind of in your rearview mirror of the Alzheimer's kind of creeping in into Charlie's mind, into your marriage for many years before the official diagnosis. What were some of those early signs and changes like?
Well, in Charlie's case, it was more like it was hard for him to pivot, like if we would change a plan. Now, he was always a very well organized and specific person. He's a graphic designer, and even when I look at his computer and I open up again, it's completely organized. And suddenly he couldn't keep track of things. But what's so unique about Charlie, and this doesn't happen to most people who have this kind of disease, is that he suspected something was wrong with him. He called it out. He was having problems in his work at UCLA. He'd been at UCLA for like 20 years as the art director and been through many different bosses. And he would complain to me in the last few years, this guy is just so difficult. He's an asshole. And I'm like, I work in Hollywood. Like, I'm used to this. Like, you know, it's okay. You'll figure it out. But he was uncomfortable. So he had watched me navigate my own mom, who was the Uber version of Heidi, can do everything, ran business, the first person to bring you soup if you were sick. And suddenly I saw my mother decline. And I saw and suspected something in her. And so I investigated that. And Charlie then came back to me and said, you know, maybe I need to go see that doctor that you sent your mom to. And she had mild cognitive impairment, which is the first thing that typically happens. And so he goes to this doctor, and I'm like, oh, I thought something's wrong, but I thought it was depression, anxiety. Yeah. I didn't know what. And we were surprised that he suddenly was being diagnosed with a dementia that they couldn't quite figure out what it was. And mostly because of his age, he got the early onset. He's 57 years old at that time, and it doesn't run in his family. They do not understand how to diagnose. They are getting much better now than they were 5 years ago to know exactly what's wrong, because Alzheimer's is the most common form of dementia. There's many, many variations. And in order to find out, it's very hard. You can't biopsy a brain, right? They really get a real diagnosis usually after a person passes, because he was told possible Lewy body, possible. And I say, what's the difference if there is no treatment?
Yeah.
So that led us first to me to deep dive into Google, research. I talked to a lot of doctors. I took him everywhere where I could. And what I found out is that there really is no treatment. And so then the question becomes, okay, but there's still a lot of life to live. And how do we adjust? How do we find the sort of the ramp that a handicapped person has to use to get up to the steps? How do I find the ramp to help him still continue? And you see he's an artist. So he was an illustrator, and he's now moved to doing collage. And now he's working with a local Vermont artist who's a wonderful potter that was a friend of ours, Jeremy Ayers. And Jeremy is somewhat becoming Charlie's hands. But Charlie is still art directing and knowing what he wants to create, right?
Yeah.
So we're adjusting and moving.
I want to go back to you here for a moment, Heidi. You just described relatively quickly what is a pretty remarkable caregiving role that you play with your mother, also in cognitive decline, your husband, your mother to two kids who are grown now, and you also have your own career. And we were talking a little bit before the film, and you said it took a while, or excuse me, before this conversation, you said it took a while for you to kind of identify with that word caregiver. Why do you think that was?
I feel like we have this negative impression of what it is to be a caregiver, and so we create this word of care partner, right? And that's true, we're partners, but I'm having to do the work for him because of the handicaps that he has. And I felt uncomfortable because, I went to Barnard. I could do anything. I could be a mom. I could work full time. I could be a great daughter. We're told to accomplish all the time.
You could do it all.
Right. And that's a fallacy. And I learned that in motherhood, that life goes in stages. I continued a successful career as a casting director, but I also had to step back sometimes and go, no, I can't do that job and that job, right? Because I wanted to be present for my for my children and my parents and my husband, and sort of have this full life. And I think we're misled, particularly as women, because we're so good at juggling, that we can do it all. So the caregiving thing was like, I don't think about myself like that. I think of myself as a casting director, as a mom, as a wife, as a daughter. But I feel it's so important to own up to caregiving because it's culturally lacking in our dialogue today. To have a society that is inclusive, to have a society that we can understand that there's an economic part to this, because I had to give up jobs to do this, right? And how am I supposed to support my family when I'm also having to work full-time as a caregiver? I work right now ridiculous hours because I need quiet time for myself at night to work. So if we lived in a world where we could talk about it, where we own it, the economics of it, I've been told, is almost $1 trillion of unpaid care. It's not just me. There's 55 million other families around the world who have dementia. And as the great First Lady Rosalind Carter said, there are four kinds of people in the world. Those who are caregivers, those who will be caregivers, those who will need caregivers, and those who were caregivers. We all give care, but we don't talk about it because it's this expectation. But at the same time, if our government and our public policy acknowledged how much it's part of it, because if a person had support as a caregiver, they could contribute more to the economy. I'm advocating now for the Credit for Caring Act, which was just brought up by Representative Linda Sanchez and Mike Carey last March as being reintroduced. It's a tax deduction of $5,000. That is not everything, but that is something that would help us. We get child care tax credits, but we don't get caregiver tax credit.
And we'll be talking much more in depth about some of those policy changes that could occur around caregiving later in the hour. We're speaking with Heidi Levitt, the director of a documentary film, Walk With Me, about her husband Charlie's early onset Alzheimer's and how it's changed their family. If what Heidi's saying about being a caregiver or care partner for somebody with Alzheimer's or another form of dementia is hitting home for you, please call in and share your story. You can call in at 800-639-2211 or email vermontedition@vermontpublic.org. Heidi, So we just talked about how you were doing all this work as a caregiver. You also are a casting director, and then on top of it, you say, "Hey, I'm going to make a documentary film." What was it like to be wearing the hats of caregiver and filmmaker at the same time? Did you find yourself having to like put one down so you could pick another one up?
It's kind of a melange. I call my production company Three Chapeau Productions because I'm always wearing three different hats, I feel, at the same time. And I feel I was motivated because I felt that this story was not out there and there was a lot of stigma and shame, and we didn't know how to talk about it. So, how could we expect other people? And I had this privilege, unique privilege. I have worked with some of the top directors working, between Wim Wenders, Oliver Stone, Sally Potter, Rodrigo Garcia, Wayne Wang. I mean, I'm really fortunate. And my partner on another project is Alex Gibney, who's a world-renowned filmmaker in documentaries. He won an Oscar, and he made a film that made him famous for. It's called Enron. The smartest guys in the room. Anyways, Alex is a force of nature. And I knew Alex and I were working together on a project. And I said, Alex, is there a movie here? And he said, absolutely. And he makes the most hard-hitting documentaries. And he was open to my personal story and pushed me to stay personal and to tell this story. So it was very difficult. And my children and my husband, I think it's the hardest thing I actually asked them to ever do, because it's so vulnerable. But I so appreciated them and my crew who sort of wove into our family structure, because it had to be honest. It had to be true. And we filmed over 4 years because I wanted to show a process. I mean, I think life is process, right? And we're always so focused on solutions. And I don't have a solution right now. I can't save him, right? This is like the hugest thing to figure out. Like, okay, we all have an expiry date. We all have something. How do we live the best? How do we make our mark? And can we help people? I told Charlie this gives us purpose. There's lots of people with this story. I have the privilege and the background in film. And as a casting director, I want to just shout out, this is the first year casting directors are up for an Academy Award. And I feel like I had so much amazing training because I love actors and I knew how to get a scene going and I understood narrative. And I had so much more background than I even realized.
Yeah.
And so I really took advantage of it. And if you look at our website, walkwithmedoc.com, you can follow our journey. And I hope that we'll be able to translate this for many people who will be seen and heard, because our story is bigger than us.
Heidi Levitt is the director of the film Walk With Me. It screens at the Vermont International Film Festival this Saturday at noon. Is that right?
Yes.
Noon in Burlington. And it's going to be followed by a panel discussion about Alzheimer's resources in our region.
And caregiving.
Yes.
We need to emphasize that because that is even more in the shadows.
Yes, and we're going to be talking about that more throughout the rest of this hour. So be sure to stay tuned after this break. But first, Heidi Levitt, again, thank you so much, and congratulations on this beautiful film.
Thank you. Thank you, Michaela, for inviting me. I really appreciate it.
This is Vermont Edition. Stay with us. Welcome back to Vermont Edition. I'm Michaela Lafrac. This hour, we are discussing Alzheimer's care in our region. As of 2020, nearly 13,000 Vermonters aged 65 and older had Alzheimer's. That's 10% of the over 65 population. And around each of those people orbits nurses, doctors, home health aides, and family members who devote their lives to care. Alzheimer's is a degenerative disease with no cure, but there is a lot of positive news right now in terms of groundbreaking research, medications that can slow cognitive loss, and new supports for caregivers. Here to tell us more is Rhonda Williams, the Public Health Program Director for the Vermont Department of Health. She's also the Director of the Alzheimer's and Healthy Aging Program. Rhonda, welcome.
Thank you so much for having me here.
We're also joined by Meg Polyte. She's the policy director for the Vermont chapter of the Alzheimer's Association. Meg, welcome.
Thank you.
And listeners, you can join our conversation as well. Are you caring for someone with Alzheimer's? Who do you turn to for support? What support do you need? Give us a call at 800-639-2211 or email vermontedition@vermontpublic.org. First, I'd love to hear from both of you after our conversation with the filmmaker Heidi Levitt. I know you two will both be part of the discussion going on this weekend at VTIF around Heidi's film. Rhonda, what did that conversation bring up for you?
Oh, I just love what Heidi is doing and what she is standing for in terms of dementia caregivers. And just to say that in the ethos of breaking down stigma, I'll say that I have been a dementia caregiver, and it's so important for us to bring to light the importance of our caregiver community, what they offer, the value that they offer, and how we are increasingly creating those supports so that they can do what they do for their families every day.
Yeah. And I want to get into some of those specific supports in just a moment. But first, Meg, what are your thoughts about Heidi, her husband, her film?
Well, I echo Rhonda in just being so grateful for her in speaking out and naming the importance of caregivers and what they offer us, and also in really clearly identifying that women bear a greater burden in caregiving, both because they provide approximately 2/3 of dementia caregivers are women, and because of the financial impact of having to leave work early, of having to skip promotions, and what that does to them and to their families' financial stability. So just so appreciative that she was coming out and just saying, like, I'm going to call myself a caregiver because we need to be honest about this. And we have more than 20,000 Vermonters who are unpaid caregivers to loved ones with dementia. So she is not alone. You are not alone. And it's so wonderful to work with Rhonda and with other folks to try and build this system that can support the person with dementia and the caregiver, because it really is a team sport here.
Meg, you said that women are much more likely than men to be caregivers. Why is that? Is it because men are more likely to get Alzheimer's or another form of dementia?
I don't actually think that's true. I think women are more likely to get dementia too. I think, it really has to do with the role of caregiver. So 44% of caregivers are caring for a parent. So that's just a really heavy burden for women to play. It is primarily women who are doing that. And 25% of those, as Heidi mentioned, are caring for a parent and a child at the same time. So they're in that sandwich generation, just caring at both ends of the spectrum. And it is a daunting burden.
Yeah. Rhonda, do we have a sense of how many people in our region have Alzheimer's or another form of dementia?
Yeah, the 2025 statistics point to 12,800 Vermont adults with dementia. And with our aging state, with age as the number one risk factor, so we're going to see the numbers increase in Vermont. And being here with Meg and being able to mention the contributions of many partners that Meg and I work with increasingly to create the capacity for supporting those with the disease who may not know it. So part of what our work underway is creating the ability across the state for assessing for cognitive decline, using best practice tools in clinic and in community, and then being able to, once diagnosis happens, is to have the wraparound care that includes the caregiver in the care team.
Well, let's go to the phones here. We have Jay calling in from Newport with some thoughts. Jay, go ahead.
I happen to be traveling down to Stowe right now, so hopefully I won't lose you. If you know the back road from Newport to Stowe, I could lose you. But
drive safe.
I just lost my second uncle to Alzheimer's he actually cared for his older brother all through his 8 years of Alzheimer's, and then he faced this himself. And so my cousins and I, helped him transition to, a care facility where he could get help. But I think, we were talking about caregivers, and I think, one of the important things is that, all the family members really need to understand what's going on with their declining relative in order to address them properly and learn some tactics to do so. Because it's going to be obvious, but certainly repeating things over and over again doesn't help them. But also the fact that their cognitive ability to reason and such has actually left them. And it's hard to recognize, and it's hard to deal with that sometimes, because you're just used to the person that you knew. But they really cannot reason often, and trying to reason with them really is not a successful approach.
Jay, before I let you go, I'm just curious, where did you learn those skills as you were taking care of your uncles?
Well, I think, it didn't really do much with my first uncle, other than the fact that, we had to address my uncle who was the caregiver that Bob just couldn't do, rationalize things the way he used to. And his brother, who he lived with all his life, said, well, these are his things. This is his home and such. And so how do I keep this from him? And it was just necessary to protect him, because he would get up in the middle of the night, he would leave, and get into trouble, whether it was, falling down the bank of next to the house or whatever. But to answer your question, so pretty much I found an online person that talked about, caregiving and such, and really, I didn't know that in these early stages, their ability to rationalize things, you trying to talk to them as if they understood, as they did before, to get them to understand things just was gone. And I think that was the best thing that all of us in the family, found as to how to approach my uncle, that he just no longer had that capability.
Jay, I'm so glad you were able to share that story with us, because I think that learning that it sounds like you had to do in the midst of your own caregiving is something that a lot of other caregivers are going through too, though I know there are resources out there to help folks learn, for example, how to better communicate with somebody who's experiencing cognitive decline. Meg, do you have other suggestions along those lines for someone who's saying, I know I'm not communicating as well as I could with this person I love so much who's changing? Where can I learn to do it a little bit better?
Yeah, I love that. Thank you for sharing, Jay. So important. And I really liked that you said, the person you knew. And it's such a dual life that you're living when you're a caregiver, because the person is still the person, and we are so focused on patient-centered care and including their voice. But you do have to recognize where the brain changes have occurred, and it can be so different from day to day, where one day things are clear and the next day there's no recollection or it's not clear. So learning these skills is vitally important. I'll start by saying the Alzheimer's Association, so alz.org, or we have an 800 number, 800-272-3900, that is available 24/7, answered by a live person. So for those caregivers who are up in the middle of the night with a burning question, they can reach out. I think one of the things that's really is helping along this is trying to destigmatize and get earlier diagnosis so that caregivers can start to build these skills when they're not in a crisis situation, because it's extraordinarily hard to change habits when you're in the midst of not getting enough sleep and just having one situation after another. And that's one of the reasons we really encourage people to learn about this and to get and ask questions and get diagnosed if they think that something's going on. And then the last resource that I'll say, and there's a lot of them out there, but we're very lucky in Vermont. We have a Dementia Family Caregiver Center that's located as part of the University of Vermont. And they offer some really amazing programs that are virtual for groups of people to learn together, not just how to care for their loved one with dementia, but how to care for themselves as a caregiver as well. And that is equally as important. So those are a couple ideas that come to my mind.
I noticed, Jay, that you're in Newport. We got an email from Susie who says that they're the facilitator of the monthly Newport Dementia and Alzheimer's Care Partners Support Group. And Susie writes, it's essential to take time for oneself if feasible. Join others to listen or share emotions and questions as you navigate this uncharted journey. Rhonda, I saw you scribble in a lot of notes while Jay talked too. What were you thinking there?
Yeah, I just really appreciate Jay calling in and sharing that, because it's not just memory loss. It's, there's other losses in the midst of the disease progression, and including, as he mentioned, loss of reasoning. And so learning those communication strategies can really help the relationship between the caregiver and the person receiving the care. And I know I've seen the Alzheimer's Association deliver to workplaces, for example, and to caregivers as well around communication strategies. So people can look for those trainings and sign up or arrange them for their workplace. I will also mention that we are in partnership in building dementia-friendly communities. And those are aimed and designed to support, whether it's a bank setting, whether it's a store, whether it's a library, where a caregiver and a person with a disease can feel welcome. And what does that look like? Well, it might be quieter. It might also have signage that is, paving the way to where to find something, whether it's in a store or an airport. We have a website at the Department of Health dedicated to dementia-friendly community building, and people can find resources there. And what's exciting is we have, just in the past year, 4 libraries, 3 libraries, and another business that have signed on as dementia-friendly. And so they've taken the commitment and they're putting in strategies so that they're welcoming and inclusive of the dementia community.
Well, let's pause for a short break here. When we come back, though, I want to talk a little bit about some interesting research going on in the Alzheimer's sphere, including a clinical trial that's focused on some lifestyle interventions that could offer some relief. That's in just a moment on Vermont Edition. Stay with us. Welcome back to Vermont Edition. I'm Michaela Lafrac. This hour, we are discussing Alzheimer's research and care in our region. Our guests are Meg Polyte, the Policy Director for the Vermont chapter of the Alzheimer's Association, and Rhonda Williams, the Public Health Program Director at the Vermont Department of Health. And we're curious to hear your experience with Alzheimer's or another form of dementia. Have you cared for a loved one? Or perhaps you're navigating that road yourself? You can give us a call, share your story, or ask for help with connecting with resources by calling 800-639-2211. Now, Meg, before we shift to talking a bit more about research, I do want to note that the last time we had you on was in 2023. We were also talking about caregiving at that time, and you were advocating for legislation to create a state dementia care coordinator. That role now exists. Can you tell me a little bit about what they do, what's changed in the last couple of years because of it?
Yes, so exciting. I am the policy director, and it's always such a thrill when you have legislation and you bring advocates in and they talk about the need, and then you see the position created, and now we've had somebody in that position for almost a year and a half now. And it has made a huge difference in terms of our centering dementia in the work that's being done. They're really focusing more on the side of people after diagnosis, although they work with us a lot to think about how we can build out our health systems, but helping to come up with more common ways that resources are provided, making information for caregivers more easy to access, understanding who's missing from the picture. Really helpful to have them bringing to us, what about the single seniors, as we say, people who may be living alone? How do we ensure that we're making resources available to them? What do they need? And really helping us to think about different types of data that we have that can help us pick the most impactful places to focus. Obviously, we need to focus everywhere. We need a lot, but we have to also move at the pace that we can build out the resources and the pace that we can educate people working in the field. So it has been hugely impactful. They're in the center of everything. Rhonda and I meet with this person very regularly, and we are so grateful to have them bringing their passion, their experience. They also have personal experience to the table to help us as a state really focus what is needed and how we can support people with dementia and their care partners.
Yeah, Rhonda, what are some of the other changes that you've seen occur in the past 2 years as a result of this position?
Yeah, I agree with Meg that was a big win for the state, and thanks to the legislature for seeing the vision of having a dedicated dementia coordinator. I think some real progress has been made in increasing understanding and awareness around lifestyle behaviors, and I know we're going to talk about that a little bit more. But also in terms of supporting our primary care with this complex disease and screening and diagnosing. So a couple of years ago, we reached out to UCLA, which has a well-regarded dementia care model. And with our neurospecialists at the memory program at UVMMC, we decided to try it in Vermont. Let's try a Vermont Alzheimer's and Dementia Care project. We are now in year 2. And really pleased that we now have a dedicated dementia specialist, a dementia care specialist, who is able to both triage what people are needing when first diagnosed to later stages of disease, and being able to have touch points and caregiver support. And in fact, the preliminary data is showing that caregivers are ones who are benefiting the most, right? There's so much stress. There's so much unknown. Yeah. And by being able to have someone who is really in-depth trained around dementia be at your side in this journey is invaluable. So our vision as a state is to have more dementia specialists who can work hand in hand with primary care in taking from screening, diagnosis, and onward.
Yeah. We've Ed calling in from Addison. Ed, what is this conversation bringing up for you?
Hi. Well, my mother, when she died about 20 years ago from Alzheimer's, and what happened was that my brother lived much further away than I did, and so I took on part of the caregiving, you might say, and he did another part. And the thing that happened was that he was really good at paperwork, so I hate paperwork. So he handled all the paperwork, and that made a huge difference because that took some pressure off of me. And I think in circumstances where families are not living in the same area, this might be a way to take some pressure off the caregiver, especially who's doing all the actual physical caregiving, to have another member of the family who may live far away to do some of the other parts of it, which are necessary in today's world.
Yeah. Ed, thank you for calling in, and your experience with families spread around the country reminds me of an email we got from Rosemary in Middletown Springs, who says, many of us are caregivers simply because there is a severe shortage of beds available for dementia sufferers in memory care facilities. I'm currently part of a community of people caring for a friend and neighbor with early onset who lives alone and has an out-of-state guardian. Medicaid covers a limited number of hours of care, and she's often alone, especially at night. This often means frequent visits at all hours from our friend, who's often unable to articulate why she's there and what she needs. Everyone agrees that she shouldn't be alone, but until a bed is found, that is part of her reality. Meanwhile, we, other neighbors, her friend group from college, a few of her relatives, and an inconsistent mix of aides from an agency are doing our best to keep her afloat as safely as possible. Meg, that patchwork nature of care seems to be a common thread that people are sharing during this conversation.
Yes, I mean, for one thing, the disease is a long disease. It's a progressive disease. It can last up to 20 years sometimes. And as we're hearing, time becomes very fluid, and day and night becomes very mixed together. So often care is needed 24 hours a day. So even in the best case scenarios, it really requires all hands on deck from anybody who wants to and is willing to contribute to that. And I really appreciated what Ed said and also what Rosemary is saying. And I want to just reiterate that the caregiver support groups are for anybody who is touched by a person with dementia. And Susie is fabulous up in Newport, but you can use our 800 number and it will zip code locate you anywhere in the country to a support group near you. Oftentimes people say, I'm not a caregiver, I'm just doing the bills, or I just set up their medical appointments. All of this is so central to that care. And then I would just reiterate, yes, we have all kinds of housing shortages. Michaela, you talk about them all the time on the show. And this is another subsection of that. And what can we do to keep people with dementia? I'm going to say in their community. It might not be in their same home, but in a close enough area so they can maintain those connections with the people that they know, so that they can go to the diner where somebody knows, oh, you like eggs, and they don't have to make a decision or see a new menu or worry about where is the bathroom. That those pathways are already there. So as we're thinking about housing, just remembering the full spectrum of people that need housing and making sure that those with dementia are part of that equation as we look at where we're going to develop or renovate.
Elizabeth from Central Vermont Home Health and Hospice says that they want to offer a free course called Powerful Tools for Caretakers, but they're waiting for enough people to sign up for it. Elizabeth shared their number. It's 802-223-1878. And they said, ask for Miss Rockwell if you call and if you're interested in that course, and then they can run it. We have Sean calling in from Richford. Sean, go ahead.
Hi, how are you, Michaela?
Good.
I came to Richford back in 2015 to take care of my dad, who was diagnosed with Lewy body dementia, and I have to say it was the hardest job that I have ever done in my entire life. It was, like the comment was made earlier, night and day doesn't mean anything. My dad would sleep for, sometimes his longest stretch of sleep was about 3 hours. And he would be up walking around the house. If I were to take some time to get some sleep, there were a couple of times I found him out in our backyard with nothing but his underwear on, and that was something I had to talk to the neighbors about. But at the time, I didn't know anything about any help that was out there. He was a patient of the VA, and we would take our monthly trips down to the VA in White River. I have to give a shout out to Dr. Devine down there. She was excellent in his care, very sympathetic and supportive. Home health was an option that we tried a couple of times, but my father was very combative with any of the people that came in to help take care of him. But yeah, it is one of the hardest jobs that I have ever undertook in my life. And I have total sympathy and support for all the caregivers out there. It's a very, very hard job.
Sean, thank you so much for sharing your story and your father's story. Sounds like he was a very lucky man to have you in his life, helping him out. We have just a few minutes left here, and I want to make sure we get to some promising research that's going on around Alzheimer's. It's called the Pointer Study, and Rhonda, I'm hoping you can tell us a little bit about it.
Yes, and I'm sure Meg will want to chime in. It's really, I think, a landmark study that the Alzheimer's Association has supported. And thankfully, they had the vision to do that because the results are showing what I think other research had been pointing toward previous to it, is that lifestyle modifications, including among those who have a genetic risk, are meaningful and can reduce the risk of the individual. And that these lifestyle modifications are ones that are available to our callers and to residents statewide. Some of those are within the sleep realm. And managing stress and keeping socially and cognitively engaged. And there are various ways to do that. And others are around what we call in public health is, promoting your own health and reducing your risk overall. So if you do smoke, stop smoking. If you don't get enough exercise, or maybe you are inactive, you can start today. Exercise matters a lot for brain health and also for heart health and nutrition. And I think a lot of research is pointing towards the Mediterranean diet. Even slight modifications are being seen as having an impact in brain health, and it's never too late to start. So the U.S. Pointer study is continuing. I think eventually we will have tailored guidance for people at various risks with various risk factors. But I think overall, what you do for yourself in terms of daily activity and what you eat, and trying to aim toward fresh and whole foods as much as possible. But, it's not expecting perfection. It's really about trying to be consistent overall. And I do want to mention that the state of Vermont has free accessible programs for quitting smoking called 802 Quits that offers gift cards for counseling sessions. Another is My Healthy VT. My Healthy VT is, if you Google that, you will find some really valuable programs for managing hypertension, preventing diabetes, controlling your diabetes, and also, if you like peer support, these are perfect programs, including also for quitting smoking. All of those are great for brain health and reducing dementia risk.
So some tangible steps that folks can take that might help slow the progress of a disease like Alzheimer's. Meg, what stands out to you? We only have about a minute left here, unfortunately, but is there one other takeaway from this Pointer study that you want to make sure to highlight today?
Yeah, speed round here. The thing I love about the Pointer study is these are things in a disease that takes so much away. You can't drive anymore. These are things that caregivers and people with dementia can do together on their budget. And I think one of the most exciting ones is to think about ways that they included cognitive and social challenge in the study. So isolation is huge. I loved how Heidi talked about the way they were scaffolding Charlie to be able to continue his art, and thinking about what can you do, who can you talk to, can you go to a farmer's market, can you join a book club, can you learn a new game with your neighbors or your grandkids, but any activities that pushed folks a little bit out of their comfort zone cognitively or social challenges were part of this study, and it really did show that you can change your brain's health through lifestyle interventions. So very exciting. The Alzheimer's Association is investing $40 million more for 4 more years to follow the participants and start to build out what Rhonda said of how can we bring these studies and these results to communities all around the country, including right here in Vermont. So really excited about that.
Meg Polyte is the policy director for the Vermont chapter of the Alzheimer's Association. Meg, thanks so much for coming back on Vermont Edition today.
Thank you for talking about this issue.
And Rhonda Williams, the Public Health Program Director for the Vermont Department of Health. Thank you as well for sharing your expertise.
Yes, thank you.
And a reminder again, if you'd like to see that film we were talking about at the beginning of the hour, Walk With Me, about Heidi Levitt and her husband, Charlie Hess, navigating his early onset Alzheimer's. You can see it at the Vermont International Film Festival this Saturday. Today's show was directed by Aaliyah Papes. John Ahrens is our managing producer. Andrea Lorian and Daniela Fierro are our producers. Today's call screener was Rick Barrett, and our theme music is by Myra Flynn. I'm Michaela Lafrac. Thank you so much for listening, and we'll catch up again soon.